Well, 2014 was a breakout year for funding in digital health, and 2015 shows that it is tracking similarly. Tell us what's different this year, especially when it comes to the sectors within healthcare that's getting the most investor interest.
I think it's just momentum's building. I think when you look at all the industries that have been transformed by the internet, healthcare was one of the ones that had not been. And so over the last several years, billions of dollars from both VCs, corporate VCs, and foundations, as well as angel investors have flowed into the market. And I think that really provides a lot of the momentum that the entrepreneurs need to really reimagine a whole host of solutions to transform care delivery and lower costs.
And speaking of momentum, this list of folks who were helping you out that Scarlett mentioned, what was the selling point? How did you get them to say, you know what, that's something I think we could do business with?
Well, my partner Unit and I have been entrepreneurs for almost 20 years, and we've developed a lot of relationships. And we thought about what was needed to transform healthcare. We knew we needed industry transformers.
But there are relationships, and there are these three gentlemen who are on the screen.
Yes. So each one of them obviously transformed industries, and they're all passionate about healthcare and entrepreneurship. And it was that combination that's very connected to our mission to really help build 1,000 companies over the next decade to really reinvent the industry. And these three backers have so much excitement for it that it was easy to convince them.
We'll talk about Obamacare. In what ways did it add, or does it add, since now we have a final answer from the Supreme Court, does it add urgency to the effort to digitize healthcare?
Yeah, well, the momentum's been building. I think when you go back to 2011 when we launched, we went down to the White House and actually made the announcement from the Oval Office with President Obama and Vice President Biden. So it allowed us then to really begin to see that business models were going to get shaken up. Everyone was going to start to look at this industry in a different way. I think last year's Supreme Court support, as well as this year's, really allows all the friction to get removed from a lot of the naysayers, if you will. And I think it just, puts for us a lot of more emphasis on letting the entrepreneurs spend the next 5, 10, 15 years reimagining every aspect of healthcare.
And speaking of reimagining, how does what you do help patients have more of a role in their healthcare instead of just leaving it in the hands of doctors and medical professionals? What's their say now?
Yeah, well, I think a lot of our tools are designed to help patients directly. Last week we made an announcement that Aurora Healthcare made an investment and announced our partnership around developing and bridging the gap between entrepreneurs and the healthcare systems. And it's CEOs like Nick Turkle, the CEO of Aurora Healthcare, who have made the commitment to actually get behind a lot of the external innovation that's out there. I think if you look at healthcare, what's really needed is a collaboration between these large organizations like Aurora and the entrepreneurs that are doing a lot of the reimagining. In every other industry, most entrepreneurs don't really care about the big bureaucratic organizations and the government. I think healthcare is a whole different ballgame, so a lot more collaboration is needed, and that's why Startup Health, as a health innovation company, is here to change that.
You talk about tools. With tools comes data, although some people would argue there's too much of it. That's already happening at the consumer level. Mohammed El-Arian, who's a Bloomberg View contributor, recently got a Fitbit, and he discovered in his Bloomberg View piece that I have no idea how I'm supposed to internalize all these data points. I find myself pursuing multiple objectives that are highly correlated, but frustratingly are not sufficiently linear, adding to the potential for performance anxiety. There's a temptation to measure everything because you can. How do you make sure that the data doesn't get in the way of determining cause and effect?
So we have 103 entrepreneurs, startups, building companies to solve that problem. I think a lot of what our thesis is that nobody really knows what's going to work and what isn't going to work. But what we do know is that entrepreneurs for centuries have led the charge. And I think the idea of taking the problem that was explained just now by someone at Bloomberg, I think emphasizes the need for entrepreneurs to really create solutions so that there's not a gap between these devices throwing off data and really turning them into actionable insights.